Back to my page. I still remain your nurse Mercy. Today I'll talk about the silent struggle many face it, but we rarely talk about it, which is infertility. 1 in 6 couples worldwide faces infertility. It is more common than you think or really talk about it. Infertility is defined as the inability to conceive after 12 months or 6 months if over age 35 of regular unprotected intercourse. You hear the word regular, not I've married for 1 year now, I've not been able to conceive. The intercourse is irregular. You hear regular there in the definition. The type of infertility, I'll talk only on the primary and the secondary. There are still other types. The primary infertility, a woman has never been pregnant despite trying for at least a year. That's when you say it's primary infertility. Secondary infertility, a woman has been pregnant before, regardless of the outcome of the pregnancy, but is now unable to conceive again. That's secondary infertility. The signs and symptoms of infertility: regular or irregular or absence of menses. If your menses is irregular or absent of menses, no menses at all, painful menstruation or no ovulation. Why some ovulate during their menstruation. Unusual vaginal discharge. Discharge from your vagina is unusual. Excessive hair growth, can be in the face, can be in the back, can be in the chest. Acne. Those excessive hair growth suggest hormonal imbalance. Weight gain or obesity. Pain during intercourse. Recurrent miscarriage. No conception after 12 months of trying. What are the causes of infertility? Infertility can be caused by PCOS. What's PCOS? Polycystic ovary syndrome. Irregular or no ovulation at all. Stress or weight gain or weight loss. Intense exercise, that rigorous exercise, it can also be a cause. Premature ovarian insufficiency. Blocked or damaged fallopian tube. Pelvic inflammatory disease, PID. Ectopic pregnancy, previous ectopic pregnancy. Uterine fibroids. Congenital abnormalities like septate uterus is a congenital abnormality. Incompetent cervix. Endometriosis. What is endometriosis? Endometriosis is when the endometrial tissue grow outside the uterus, affecting fertility. Genetic abnormalities. Cancer, chemotherapy and radiation can also be the cause of infertility. The risk factors: smoking, alcohol or drug use, high stress level, STIs, sexually transmitted infection, family history of infertility or early menopause. When to see the doctor? Trying to conceive after 12 months or 6 months if over 35 years of age, of regular unprotected sexual intercourse with no success. When there is irregular period or known hormonal issue, please try and see the doctor. When there is history of pelvic infections or history of miscarriage, please try to see the doctor. The treatment depends on the underlying cause. Lifestyle modification, weight management, healthy diet and regular exercise, stress reduction, avoid alcohol, tobacco and illicit drugs. Medication can also be used for the treatment. Hormonal treatment as well for prolactin issues. Surgical interventions, can use surgeries, that's removal of fibroid, treatment of endometriosis, repair of blocked fallopian tubes, assisted reproductive technology. It can be intrauterine insemination, IUI. It can be IVF, in vitro fertilization. It can be egg or embryo donation. And the important thing to know about is that you are not alone. Infertility is a medical condition, not a personal failure. The good news is there are many ways to diagnose and treat infertility. Please like, share, comment on my page. Stay tuned for part 2, where I will talk about infertility in May. Bye.